Hello, and welcome to the second session of our talk about grief after miscarriage. We will focus on the effects that a miscarriage can have on fathers, on relationships with others, and on siblings of the miscarried child. Many studies put all of their focus on mothers when looking to understand grief after a miscarriage, but it's just as important to understand the effects of miscarriage on fathers. Culturally, men are expected to stay strong, not cry, and be supportive of their wives in response to loss. This pressure to be practical and not express emotions can make it difficult for men to address their feelings of sadness in a way that enables them to move on. Studies have corroborated these ideas by determining that men show grieving symptoms less than women in reaction to a miscarriage. However, this does not mean that men grieve less. It simply means that they deal with and display their grief differently from women. In fact, men are more likely than women to be unable to cope after the miscarriage and to experience feelings of despair. Not only are men expected to be strong and stoic, but people do not view miscarriage as a loss that affects the father and mother equally, so fathers often feel overlooked and are treated like a bystander by those who are trying to be comforting to the mother, which intensifies already existing feelings of isolation. Because men and women differ in their grief reactions, it can be difficult for a husband and wife to understand that the other's grieving experience is just as valid as their own, and so both parties tend to try to regulate the other's grieving process. Their differences in mourning can result in spouses feeling isolated from one another. Sexual activity tends to decrease following a miscarriage, and it continues to be lower than normal throughout the parent's grieving periods. This is often due to the lowered self-image that the woman is experiencing due to the abrupt end to her pregnancy and the loss of her child. Typically, men notice the lack in sexual activity as a response to grief more frequently than women, who are more likely to describe lack of communication as the primary negative outcome of their grief. Though relationships often suffered during the grieving process, one study found that in the long term, marital relationships were not typically adversely affected by having recurrent miscarriages. There is limited research on both the short and long-term effects of miscarriage on marital relationships, so it would be beneficial for future research to focus on this particular aspect of grief after a miscarriage. Though miscarriages usually do not have an adverse effect on the relationship between the parents and their other children, studies show that mothers who were unable to move on from grief were more likely to have a future child with infant disorganized attachment behavior. These behaviors include, for example, a child being distressed when their caregiver leaves and ambivalent upon their return, a child acting indifferent toward their caregiver leaving and returning, or a child showing a general lack of interest in things around them. Additionally, infant disorganized attachment behavior can be a predictor for aggression in childhood and adolescence, as well as dissociative disorders. It is important to remember that although some of these women struggle to bond with their babies, the majority of women who have a history of miscarriages are able to bond with other babies as easily as women with no miscarriage history at all. While miscarriage obviously has a negative effect on parents, the siblings of the lost baby have an entirely different experience. Many siblings grow to identify themselves as the memory keepers of their miscarried sibling, and they have a positive feeling associated with thoughts of the child as opposed to feelings of grief that their parents experience. At the time of the miscarriage, many siblings do not have the capacity to fully understand what has happened, but they're affected by watching their parents go through their mourning and grieving periods. If communication is not sufficient, the child may become worried because of their parents' distress. In some cases, they may even feel that their parents do not care for them as much as they did before the miscarriage. Even very young children are able to understand the idea of a miscarried baby, but many parents do not realize this and often choose to not talk to their child about the loss, which leads to the children coming up with their own reasoning for the death of the baby. If a child was unhappy to have a potential rival in the house, for example, they could believe that their thoughts killed the baby, which can lead to incredible guilt. Another possibility is for the child to think that the parents killed the baby and become scared of their parents. One study analyzed a case in which an 8-year-old boy was acting out due to a very real fear of his mother after she had a miscarriage. He lived with this fear because he remembered hearing, as an 18-month-old, that his baby sister was a stillborn. Since this tragedy was never explained to him in detail, he dwelled on it for years and ended up coming up with the conclusion that his mother murdered the baby. This is an extreme case, but it very clearly illustrates the fact that children can be deeply affected by their parents' miscarriage, even at a very young age. Because of their inability to fully comprehend the concept of a miscarriage, it's incredibly important for parents who have had a miscarriage to talk to their children of all ages about what has happened. This will help to eliminate potential feelings of negativity, fear, or confusion. This concludes the second part of our talk about grief after a miscarriage. Thank you for listening.